You've heard of autoimmune diseases. These are conditions where your body attacks itself, whether it's the joints, the eyes, the brain, the salivary glands, the skin. There are so many ways, unfortunately, that your body can attack itself. And our job is to hopefully treat that if it happens, but also to prevent it if we can. Some people are considered high risk, and that means that maybe that they have family members, for example, who have these autoimmune diseases, and they're hoping to prevent it. Or it may be that somebody has checked a blood marker previously and it was positive. You have the antibody, but you don't have the disease yet. And so you're also considered a high risk. So in these cases, and even people with autoimmune disease, we want to see if there's other ways to approach it with lifestyle to see if people can do better and feel better. As a rheumatologist, I prescribe a lot of medications, and some of them are life-changing. I think my patients are doing better because their inflammation markers are coming down. The swelling is getting better, but they may tell me I don't feel better. And this is where you have to take the lifestyle approach to see if that is something that would help you, because it's not always going to be medications, unfortunately. Sometimes you have to control it on your end. We can't control everything, but what we can control is what we put into our mouth. We can control our own diet to an extent. I know it's not easy, but we can definitely take some measures that will help us. I'm Dr. Neha Banasali. I am a board-certified rheumatologist, lifestyle medicine physician, and internal medicine physician. I love to talk about autoimmune disease. It's something I'm passionate about, as well as lifestyle medicine, and how the two of them can work together well. So let's talk about some foods that may be better to avoid if you want to feel better and you have autoimmune disease. Let's talk about the first. That's highly sugary foods. Muffins, cupcakes, cakes. These are foods that have high sugars, are very tasty. I love them too, but at the same time, they're associated with a lot of poor effects for your body. For example, the excess consumption of sugar and refined carbohydrates is associated with something called AGEs, advanced glycation end products. And these are also associated with aging and being poor for your body or being bad for your body. They're associated with unhealthy weight gain. They're associated with different changes in your body like gut permeability, and changes in your cholesterol, as well as accumulating fat. So if you have more fat, you could have other conditions like fatty liver, for example. Of course, gaining weight overall, but something like fatty liver, which is very common, you may say to yourself, okay, it's not an autoimmune disease, which is true. So far, we're not finding that. But at the same time, a rheumatologist or other physician, they may have problems advising you to take certain medications because your liver is already affected in a different way, and that might keep you from taking another medication that may be very helpful for you otherwise. So you want to avoid these high sugary foods. If you're going to take them, maybe try fruits instead, which do have sugar in them, but it's a better sugar for you. There's no actual nutritional benefit when you take all this large amount of sugar, for example, from that muffin. Too much sugar, you can have high blood sugar, insulin resistance, metabolic syndrome. You could have issues with dental cavities, which certainly isn't helpful for a lot of our population who has dry mouth. And of course, there's other factors associated with this. I have a tip for you. If you're gonna grab a sandwich and it comes with a soda and a cookie, better to avoid the soda and the cookie. However, if you must get that cookie, try to split it with 3 other people so that you're overall taking less of it. Number 2, highly processed foods. What are they? And a lot of people don't actually realize what they are. So let's talk about them. For example, something like chicken nuggets, French fries, pizza when you go out and get it, or even a yogurt, a flavored yogurt that you're buying in the store thinking it's so good for you. Well, look at the ingredients and see what's in there. Do you recognize every ingredient in that yogurt? Because you should. It should be an easy food to consume if that's what you're going to eat. But if you don't recognize it, there's a chance that it could be a highly processed food. Other foods that are similar to this are biscuits, breakfast cereals, carbonated drinks, instant soups. Make your own soup. I know not everybody wants to cook and not everybody has time to cook, but when you know what's going in your food, less likely that there's preservatives and other things going in it that you don't want in your body. So my tip for processed foods is make it yourself if you can. You don't have to be highly elaborate about it. Something simple is very okay. A 4-ingredient soup is possible. For example, potato, milk if you drink it, vegetable broth, onions, and mixed it together. It's quick, easy, and it's a comfort food. So as opposed to a snack, which is perhaps a fried snack that you were going to grab instead, you could do something like a warm, cozy soup that actually doesn't take that much time. Something like ramen noodles, which several of my family members love, including me. Instead of buying the instant packets of ramen, which I know are super quick to make, it is also still cheap if you go to the store and you get a big kind of package of it, and they come in little bundles, right? So yes, you would have to make your own broth, and you put in your own seasonings, you put in your own noodles, and you add a few veggies. But it's still going to be less processed than having that instant packet from the store. Another tip is a yogurt, a fruit yogurt that you want to buy from the store because it's so easy to get and you're thinking to yourself, it's healthy, it's got protein, it's a fruit yogurt, but actually look at the contents. There's so many things in there that you may not understand, and it's a lot of sugar. So just eat your own yogurt at home and add fruit to it. It'll be cheaper in the long run too. Number 3, gluten. If you don't actually have celiac disease, which is when you have an allergy to gluten, then you may not be gluten sensitive. But actually there is a large amount of people that are sensitive to it, not allergic to gluten. And there's a category, it's called NCGS, non-celiac gluten sensitivity. And it's an emerging entity. The problem is there are actually no tests that you can do for it, blood tests or otherwise, that are reliable. So stop paying for those expensive tests at places that are saying, we'll test your gluten sensitivity. Do one thing, just cut out the gluten. If you cut it out for 1 to 2 months and you feel better, there's a good chance that you're sensitive to it, or you're sensitive to other products that are like gluten, and that may be an issue for you. So there's so many different parts of gluten. It's in so many different kinds of grains and foods, but not all of these things will bother you. So you'll have to isolate it one by one. And so what I would suggest for this is to have a food journal to see if things will bother you, because everything is not going to bother you. And you do not have to cut out everything from your diet. But there are people that tell me, my own patients will say, Doc, I can eat this type of bread, but I can't eat this one because this will bother me. It'll cause bloating. I just don't feel well. Because it may be the preservatives in that bread, and that's entirely possible. Every human is different and all their triggers are different. So keep a journal to see what bothers you. Look back 48 hours, from before. So if you're feeling unwell, look back and see, did I eat something? Is there a pattern? Is this what is causing me to have a flare? And maybe that's what you can cut out. There are also different grains that have gluten in it that you may not realize have gluten in them. We've all heard about wheat that has gluten in it, but there's other things like, for example, spelt, couscous, semolina, farina, farro. All of these actually have gluten associations. So this may be something you also want to look out and see if you need to cut out to see if it helps you feel better. The next food that I'd like you to consider cutting out, if you can, or at least seeing if it bothers you, is dairy. Now, dairy is pretty complex because it doesn't bother everybody, but it is considered a pro-inflammatory food by a lot of people. And there's different forms of dairy. You may not be able to have a scoop of ice cream or a cup of milk, and that might bother you. It might cause a rash in some people. It might cause pain in other people, but it might be that you're able to have a bowl of yogurt with fruits on it. But it depends. It depends on if you have a true daily intolerance, a true dairy intolerance, or if it's something like that, you're sensitive to certain items within dairy. So that's another good reason to have a food journal, to see what really bothers you. And let me give you an example. There are some people that cannot have a big old gooey cheese pizza. But at the same time, if they make a pasta, maybe it's a pomodoro sauce, maybe it's a tomato sauce based pasta. And if they grate a little bit of hard cheese, not the processed cheese that you get in the store, but actually like a block of hard cheese, and they grate a few shavings of that, they're okay. That doesn't bother them, and they feel like they got a little bit of a taste of a cheese, and since that's what they love, and it doesn't really bother their body. So that could be a different way around it. Check what actually works with you. So avoid the highly processed foods, the cheeses in the store, but maybe if you really want to have it, you can have your own at home if you grate some of them or shave a couple pieces. And that might be okay. It depends on the person. Or maybe try a non-dairy cheese. If you've never heard of something called nice cream, which is using frozen banana as ice cream, it actually can be pretty good. I've given it to my kids before, and it's just basically frozen banana that you're grinding up. You could add cocoa powder to it. You could add different chocolate chips at the end if you wanted to just give it a little bit of a boost. But try different alternatives. Instead of getting that thick, fat, dairy-filled ice cream at the store, maybe consider a fruit sorbet. Of course, it's a lot of sugar, so you want to go for one that's a little less sugar, however, or cut your portions, but just look overall at what you can do to improve your food intake. Next one is excessive alcohol. And why I say that is there are diets out there like the Mediterranean diet, which say red wine might be okay, and there's a lot of people that say alcohol is fine. The more recent studies, unfortunately, are saying that alcohol is really not beneficial, and drinking pretty much at all is not helpful for any reason. So the studies are not all full and up to date. And yes, there are people in the Mediterranean diet who do better. So if you're going to drink alcohol, then I would keep it to a very much of a minimal and do it in moderation, because I don't see any studies that are saying it's actually helpful at this point in time. We'll wait, watch, and see if anything changes there. And last, the fatty foods and fried foods. So these are foods that are high in saturated fat. We don't want to eat foods high in saturated fat. We often think of red meat as an association, which is a pro-inflammatory food, and it is something that we want to avoid if we want to avoid inflammation. So avoid the red meat, but there's also different types of fatty foods. There's deep fried foods. We talk about French fries, chips, cakes, muffins, cookies, ice creams, other frozen desserts, those really tasty frozen multi-layer ice cream cakes. All of that stuff actually is a fatty food. If you're having a lot of butter or ghee, you may want to switch to using some olive oil, something else that is less high in saturated fat. And if you're using, like we talked about before, processed cheese, you may want to switch to a cheese, harder cheese, and use a very little amount if that's really what your craving is. Instead of getting French fries from the next fast food place, try making a baked potato at home. It's not actually that hard. You can control the toppings that go on it, and so you know exactly what you're getting in you. There are several other types of foods that may make your symptoms worse. Be your own advocate and see how you do. The goal is not to make yourself miserable and not to avoid all foods, because I don't see people doing well with that. Some of these very difficult to follow diets, they can help the body. The elimination diets, all of those, I see people that definitely feel better on them, but they're hard to maintain. So in the end, you want to find a diet that works for you. You want to try to minimize the bad foods, increase the good foods, eat well, enjoy your food, and move.